No. Dr. Auerbach, we talked about periodontal disease and how that can, for all purpose, ruin a person's health, period. Kidney, liver, immune system, premature baby, name it. Heart, and of course, brain, all kinds of stuff, simply because the body gets poisoned. Now, in terms of surgery, in terms of fixing this, we talk with all dentistry. There's a bad stigma about it. Going to a dentist is kind of the last thing most of us want. And the knife, we don't want it. So gum surgery, has there been improvement made in the last years so that gum surgery or maintaining the gum, fixing the gum, if they are in bad shape, isn't anymore as bloody as it used to be?
Oh, absolutely. The laser therapy to help with the gum disease has been a tremendous improvement. Instead of using a scalpel and having all that bleeding, there's a laser energy that can do the procedures. It creates less bleeding. It actually kills all the bacteria with that laser energy, so it makes it a cleaner heal. It actually bypasses a stimulus that causes the pain, so there's a lot less discomfort afterwards. So the healing is more rapidly accomplished, and the patients are able to go back to work or whatever with very minimal discomfort and a lot quicker. The other thing is that we're finding that when it's cleaned with the laser energy, we're getting better adaptation because to the root of the tooth. Normally, when you do the surgeries, we're talking about lowering the gums so that you don't have a deep pocket that is hard to maintain. And so they would cut them away. There are advances with getting bone to go back in there, but with the laser therapy involved, we don't really find ourselves cutting the gum away as far as we're now disinfecting, cleaning it, and the attachments and the bone seems to be filling in much better on its own. So that's definitely been a huge improvement for the gum treatment, the periodontal disease.
Well, very interesting. Let me ask you, is this type of treatment already very common? Basically, every dentist, if you have gum disease, will do it that way these days, or not completely yet? I just try to get a feeling of how new, how common are we talking about here?
Yeah, I don't think it's that common yet. There is a specialty called periodontists who deal with the gum disease. So I don't think most general dentists offer any of that therapy. And then the periodontists, I'm not sure how advanced. I don't think that most of those have caught on to this therapy yet. Although at our office we do have a periodontist that comes in and does the laser therapy. So we want to be cutting edge and doing the best for our patients, and that seems to be the way to go.
Well, with no doubt about it. I have talked to other dentists or doctors, and it's nice that quite a few of them, but unfortunately not all, are kind of like willing to invest in equipment because this stuff isn't inexpensive, It's kind of like, and you can't charge more to the patients because of it and all that stuff. So the point is, you gotta update your equipment. You cannot fall too far behind. We see it in roads. If the potholes get too much and the road falls too behind and the drains and the buses get too outdated, for a while maybe the government or the taxpayer saved some money, but on the long run they'll just pay way more by not being ahead of the curve, so to say. So basically you have that equipment, with no doubt.
Yes.
Other ones will have it too, but not yet necessarily everybody. It is still out there, a little bit new, and definitely an advantage to the patients. He just has less pain, gets faster, gets cured better, less after effect and all that stuff.
Absolutely.
Good. And wonderful. We'll talk another video about, how to prevent gum disease and all that in the first place. That probably has to do with lots of brushing, flossing, and going to the dentist regularly, I'm sure. But, we're going to make another, I'm going to ask you that question a little bit more specific, so that we can do things at home, which is, I think, also important, right?
It's very important because we only see you anywhere from 2 to 4 times a year, but you have to clean your teeth daily to keep that plaque off so that the gum disease won't get out of control and to keep it healthy.
And I think especially if you accumulated gum disease at one point and had one of those surgery, then there's a little bit more in terms of maintenance to do. Otherwise, you kind of fall back a little faster again. Is that true or not?
That is true. The studies are showing that the bacteria creating the gum disease can start to cause that effect again within about 90 days. So an ideal interval, as long as you're keeping your teeth clean, is to get them professionally looked at as well, especially after you've had any previous periodontal treatment, surgeries, deep cleaning, stuff like that, to keep that healthy every 3 months.
But that maintenance, so to say, isn't as rigorous anymore as doing the original surgery, is it?
No, it's much better to keep on top of it rather than let it get back out of control and having to go through the other procedures.
Good. All right.
It's less costly, less painful, less invasive, all of that. It's much better to maintain the health and be regular.
Well, sometimes I'm not so sure, but most of us are not inclined to get our cars more detailed and make sure we get our 20,000 miles checkup, much more religiously than we get our checkups in health and teeth and stuff. I'm not so sure about it sometimes because, I'm a little sloppy in both of them.
Yeah. Unfortunately, that's true. And sometimes, time just goes by. Everybody keeps busy and they think it's only been a few months and it's been a year or something. So it's important to keep up on it. But you're right, things happen and not everybody does it like they should.
Right. I have seen myself arguing with my dentist of saying, no, that's not true. I was not here for 1 year. I was just here a couple months ago. He goes, no.
Yeah. Time flies.
Bye-bye, doctor.